Good evening, everyone. Thank you for joining us tonight as part of the UT Health and Mercedes-Benz Dealers of Greater Houston as we bring this special event to Mercedes-Benz of Sugar Land. My name is Derek Brown. I'm the Vice President of Marketing and Business Development here at Mercedes-Benz of Sugar Land. And this is the fourth of a series of 7 events that will cover a variety of health topics. This is our 15th year in the community. We spent a great deal of time dedicating ourselves to bringing awareness to issues such as STEM with our support of the Fort Bend Children's Discovery Center, our exclusive driving safety school for teens, and of course our love for performance vehicles through our web series Hot Laps. But tonight it's different. Tonight our focus is on our partnership with UT Health and to bring awareness to the work that's being done by a variety of people at the clinics and the university. And so tonight our topic, as you all are aware, is your aging spine. But before we do that, I'd like to make a special announcement that as part of tonight's event, we're giving away 2 $5,000 scholarships to the UT Health Public School of Health. We appreciate those. Behind the scenes, there are plenty of people that coordinate these efforts, and we applaud those unsung heroes, and we are excited for the opportunity for these 2 recipients. Tonight's program, Your Aging Spine, is presented by Dr. Mark Person, standing here on my left. He's the Associate Professor in the Department of Orthopedic Surgery at McGovern Medical School at UT Health. He's also the orthopedic consultant, spine surgery consultant for both the Houston Texans and the University of Houston. He specializes in degenerative spine surgery, spine trauma, and complex fractures. The Q&A portion of tonight's presentation will be moderated by Karen Kaplan, medical journalist and longtime member of the UT Health community. Once again, we appreciate you coming tonight and joining us at Mercedes-Benz of Sugar Land, and I'll turn the time over to Dr. Mark Person. Great. Dr. Person, the time is yours.
Sure. Well, thanks for the introduction, Derek, and I'm very happy to be here, and thank you all for having me. I appreciate you attending and listening to what I have to say. Hopefully I can offer some good information for you all and you know, maybe your loved ones or anybody else in your lives. The real reality is that what I do is take care of something that's really prevalent. So back pain occurs almost in everybody. So almost everybody in this audience at some point in their life will have some injury or issue with their back or their spine. It's the second most common reason people seek medical attention. So the first is upper respiratory infection. The second is typically low back pain. So 95% of people, again, almost everybody will have some issue with their spine at some point. So probably the most difficult thing about what I do isn't that there's so many people that have back problems, because really the vast majority of people that have some type of back pain or neck pain or whatever it is probably should seek initial care by their primary care doctor. So it's not like I'm overwhelmed or flooded with business. The biggest problem or the most difficult thing to assess with patients is where is the pain coming from? And this is the same thing with the primary care doctors or family practice physicians. So back pain has been described as an enigma. There's actually a paper in the JAMA and a similar one in New England Journal of Medicine in the past decade that described back pain as an enigma. So why is it an enigma? Basically, we call it that because most of the time we have no idea why your back hurts. That's with the most advanced medical imaging and with the most astute physician examining you and taking a history and physical, and your history, most of the time we don't identify an exact cause of why people's backs hurts, okay? So just because you have an MRI and the radiology report has this plethora or long list of things that aren't normal, it doesn't mean that those are the things that are a big problem in causing your pain or your discomfort. The vast majority of the time, we think it's likely a soft tissue problem. And most likely that's going to be something to do with the intervertebral disc, which is the cushion that's between the bones. Or it may be something else, soft tissue-wise, which I've done a good bit of research and a lot of findings show that it may be the muscles around the spine and your core that are the reason that your back hurts. So there are a couple real realities in the world as far as spines go. So 3 things are basically inevitable. So I like to describe this, and actually my partner first used the term that life is a kyphosing event. Okay. So life is a kyphosing event. So what does that mean? So basically, kyphosis is where your spine tilts forward, okay? So if you notice, like sometimes we see some unfortunate individuals when we're out or whatever that start to walk more and more hunched over, right? So the reason for that is because spines degenerate. So that's the other real truth and unfortunate thing is that everybody's back or spine is going to degenerate. And that's what these findings are on MRIs that people see and radiologists report on. So basically, your spine's going to be the most perfect it's ever going to be when you're born, and then it's just a downhill event from there. So really pessimistic attitude, right? But and you know, the real truth is that most likely none of you are going to require an operation. Okay, that the vast majority of people that seek medical help for back problems are never going to require surgery. So sort of unfortunate for me, right? But not really in reality. You know, the reality is there's plenty of people that get filtered out before they see me that, you know, have real spinal pathology that may benefit from an operation, you know, and of course we try to be as conservative as we can and treat people non-operatively first, because there's lots of great non-operative things, and I'm going to talk about a lot of that stuff because, you know, my goal tonight is to talk about preserving your spine and keeping you all healthy and active and fit and moving and doing the things you like to do. And so there's a lot of ways to do that short of having surgery. And again, just to reiterate, most people will never require surgery, right? So again, 95% of people will have pain at some point. It'd be pretty astonishing if everybody needed an operation, right? I would certainly bankrupt healthcare, right, with my practice then if that was the case. The other reality in my life is I take trauma call at the busiest trauma center in the country, you know, at Memorial Hermann, the medical center. And so a week of that, I did 14 operations last week, and I can tell you these were people that were badly hurt and really needed an operation. So, you know, there's a different ball game there. So the only time